Yep, you're with DXB today. Hope you're enjoying the show thus far. And I hope you're listening carefully and taking a little bit of advice, free medical advice for you this evening, right here on the show. And you know what we said a little bit earlier on? Don't just go to online and get all your diagnoses there. We've got an actual, real, live, breathing doctor joining us now here on the show. The Dr. Reinhold Zimmermann is a consultant urologist at Clemenceau Medical Center Hospital, and Doc joins us now here. Reinhold, really good to see you. Thanks so much indeed for being with us.
Thank you very much for having me. It's a pleasure to be here.
A specialist in urology. Well, look, we're going to talk medicine in general, but let's just start with urology if we can, because again, it reiterates my point that everyone's become a sofa specialist when it comes to medicine, but not all of us have studied for over a decade in a specific discipline as well. So we go to our screens and we ask, etc. Let's start with urology. What is urology, the practice of urology, and why is it specific and special and important to us on a daily basis?
Okay, what is urology? So let's look at the organs, what we are dealing with, right? So we're dealing with kidneys, bladder, where the urine is collected, prostate for the males, and all the organs lower down. For instance, for the man, very important with erectile function, etc. and everything, but we are also taking care of females. So around, let's say, 30% of our patients are females because they have the same diseases as the man can have as well. So why is it particularly important? I mean, every specialist feels his specialty is the most important one, right?
More important than you, yeah.
Exactly. So I don't want to be the same, right? But if it comes to overall life, quality of life, etc., and this is what you were discussing just before, it's actually urology has quite a big role because, for instance, for the males, you can see very small signs in little things which later become really important and eventually just indicate a disease what you would otherwise not be able to become to know in an early stage. So for instance, you can recognize a problem with your arteries, unrecognized high blood pressure, or an early diabetes because of a decline in the sexual function. Just as an example, right? Yeah. We don't want to point this out too much, but in fact, for the man's health, that is something which is super important, and people are not so much aware of it.
Yeah, of course. Yeah.
Or sometimes
doesn't get discussed about.
Exactly. I mean, it's actually people are getting more and more open-minded in this regards, and otherwise, people come to you. A man comes to you. He's a high-performing specialist. He's telling you, okay, I'm not able anymore to exercise properly, I feel tired, all these kind of things. Then have you ever checked your hormones? The same topic what you have brought up before, right? No, and then it turns out that this guy has a testosterone deficiency of the male hormone. So for some reasons, for instance, just to take a use case, I'm seeing many pilots, right? And they come for a totally different reason, because they just need to be checked or they have a particular problem. What we have to assess even from an aeromedical perspective, right? Are they fit for flying? And then just on the side, we open the subject, and then it turns out that this guy has a low testosterone. Do you want to fly with a pilot who has a low testosterone? I wouldn't want to, right? Because it has so much impact on your overall performance.
Of course, yeah.
Just as an example.
And maybe following on from that, speaking about women and what you see commonly in women, could you tell us a bit more about that?
Okay, I mean, generally, women are taking much more care of their health than men. I mean, that's a matter of fact, right? For instance, early, or let's say screening, men are very bad in this. Only say 20 to 25% of men regularly go for screening. Women are different. Women are still, of course, urology is a very important topic for women as well, because there are so many underdiagnosed or non-diagnosed diseases in women. For instance, after childbirth, so many have a problem with urinary continence or incontinence, ability to hold the urine. And I think it's just, nothing can be done about it. I better cope with it and carry on my regular life. But that's not right. And so many things can actually be done about it. And it's sometimes not even, or many times not even very difficult. But yeah, this is something what definitely is a very important subject in urology, even for the females. And I'm seeing actually here much less women than in Europe for this topic of urinary incontinence. This has been one of my subspecialties before, in Europe, where we run big multidisciplinary centers, pelvic floor centers, for instance. Here, we are trying to establish the same, but the awareness is not the same. So I wonder, it's the same people, but they don't necessarily want to come to the specialist when it comes to the same problems. So this is definitely something which needs to be addressed and also improved.
Doctor, it's interesting. We were talking earlier about bedside manner and having that good relationship with your doctor. Do you think, because you said an interesting thing earlier about men not checking and women more looking after themselves and so on and so forth, what is it? Is it an embarrassment thing? Is it the relationship? What is it about men not doing that? And because there's some serious symptoms that we should not ignore, what would you say there? Oh.
I mean, let's start a little bit earlier, right? Let's leave the serious symptoms away for a moment, right? So why don't men want to come and check? It's first of all, I mean, we have to be clear about this. The urologist has a bad reputation, particularly for the men. Because, you know, in the old days, we had to apply some, you know, awkward examination techniques, which were not necessarily appreciated by everyone, right? With no details. Which is, by the way, just for everybody's reassurance, is not needed these days anymore, okay? So, this is one thing. So some people are just afraid because they know, okay, I've heard about it from a friend, about his visit with the urologist, and he didn't enjoy it. So I won't enjoy it either, so I better don't go at all. So that's number one. Number two is, of course, men are supposed to be heroes, right? A hero doesn't necessarily need a doctor because he's a hero anyway, so he's untouchable, he's invincible, so no problem, so he doesn't need anybody. And then, number three, it's of course anxiety as well. What if something pops up, what I don't want to know? What has a serious consequence, etc., etc., and so many other things as well. So it's actually a mixture out of everything. It's culture, it's the man itself, it's the reputational thing, what I have mentioned before, and it's also, I mean, people just don't know. We have to be clear about this as well, you know, because, I mean, in Europe, for instance, how many years we have been promoting screening programs, for instance, for prostate cancer, just as an example, right? And the blood test, etc., and so on and so on. And of course, the awareness has been created. And then, funny enough, it turned into the opposite because, you know, there was a heavy overutilization of these kind of things, which just brought them nowhere, but it caused a lot of, you know, false information, false impressions, and anxiety as well. So we really have to find the balance. But of course, awareness definitely needs to be created. And awareness doesn't come if the person thinks, anyway, I don't have anything because I can't have anything. I'm not supposed to have anything, right? Because we are strong. I think this is many times is a valid reason for people not to come.
Doctor, it's really very interesting. We see a lot of the same reasons for not getting tested in our clinics. 1 in 5, it's fear of results. They don't really want to know what might be wrong because if there is, they have to deal with it. It's also cost, convenience, and a very big one that we see is not having any symptoms and feeling healthy in general. So really, really interesting that you've got the same things coming up. Obviously with the World Health Expo this week, it's very exciting. I just was wondering, what are the sort of technology and innovations that are going to be driving the future of urology from your perspective?
Okay, well, that's indeed a very exciting question. And, you know, urology has always been a very tech-savvy discipline. And we have seen quite a big evolution in urology itself. So it's a very wide field, and I think we don't even have enough time to talk about this. But just to touch the most important topics, what is super important for us as urologists is, of course, the whole field of robotics. Because there has been so many things have happened for the last 10, 15 years. I mean, that's just amazing. And the evolution of the robots is just going on and on. But robotic surgery is still surgery, right? So that means at one point, something has to enter the body, what not everybody feels comfortable with, right? So now we are going to reach eventually the next level, where in some cases, surgery might not even be needed anymore because we're coming more towards targeted treatment or technologies which allow you to do treatment from outside the body. So you don't have to enter the body anymore. Just as an example, prostate, before, when it was cancer, unfortunately the prostate had to be removed, and the surgical robot has been a game changer in this, because before it was really a big operation with all the implications. Now it becomes a very targeted procedure where the surgeon who is doing the surgery, by the way, it's not the robot who is doing the surgery, right? The robot is just a tool, but it's still the surgeon who is sitting on the console and performing the surgery. However, you can see everything in so much details. You have a 3D visibility, etc. The robot is even helping you to eventually prevent mistakes. And so this is one thing. And now you go further and you find out for prostate cancer, you don't necessarily have to remove the whole prostate anymore, because thanks to the advancement of imaging studies, MRI, for instance, magnetic resonance imaging, you find out where the spot in the prostate sits. So you don't necessarily have to treat the whole organ anymore, but you just treat the spot. So focal therapy becomes now a very hot topic, because nobody's keen on undergoing a surgery if there is another way. So this is really exciting for us. So surgical technologies and also imaging technologies.
Exciting times, yeah.
Thank you so much, Doctor. And I know you're at the forefront of robotics here as well. That we could have a whole show on this.
Next time.
Not only one.
But, yeah, exactly. But thank you so much for being here.